Hi everyone. So today I'll be discussing something about thumb sucking. I know most of you must have seen children sucking their thumb or sucking their fingers, and some may find it cute and some may find it insightful. But whatsoever it is, we need to understand that why is it important to discontinue thumb sucking overall if it's a habit in a child. But before that, we need to understand that thumb sucking is not always abnormal. What I mean to say is, thumb sucking till the age of 4 to 5 years is absolutely normal because children of that young age group um, have that feeling of security, have that sense of security attached to thumb sucking or digit sucking or finger sucking, whatever you may call it as. Now, if the child continues thumb sucking even beyond the normal age group, that is, even beyond the age of 5 years at the max, then it is high time that we should now stop the child doing this. But before that, we need to understand that why is it bad. So the first reason is because it is a non-nutritive sucking. That means your child, while sucking thumb, is not getting any nutrition out of it. And if a child is over a period of time involved in something that is non nutritive, obviously it's going to hamper the nutrition that the child will take from outside. That will hamper the amount of nutrient that he will take or he will feel like taking from food. So, hunger will be affected, food pattern will be affected because he'll only feel satiated. His hunger will be satisfied just by taking thumb. So, that needs to be stopped first. So that's the very first reason. The second reason is that it has got several adverse effects on your mouth and your teeth as well, and they are open bite. They are that means the upper incisors, the upper front teeth are forwardly placed, and the lower front teeth will be backwardly placed, and there'll be maxillary constriction also. What these are, we'll be discussing in detail in our following slides. Okay, now open bite. So, open bite basically means no vertical overlap. As you can see in the picture, also, the upper front teeth and the lower front teeth, they are not overlapping each other, right? So, there's a space in between them. And when the situation like this arises, wherein there is no vertical overlap, instead, there is a gap in between the upper and the lower front teeth, we call that situation as an open bite. Together with that, the second point that we discussed in our previous slide, that means you see the upper front teeth, they are so forwardly placed, and you see the lower front teeth, they are slightly backwardly tilted. So that increases the horizontal distance also. So you'll see in some children who are habitual of taking thumb or habitual of taking finger, that increases the horizontal distance. That means you will see that their uh, upper front teeth, they are forwardly placed, and you will feel that they have, and they're not able to, and you'll see that they're not able to close their lips also properly because the teeth are forwardly placed, especially the upper front teeth. So these are the changes that can be seen because of thumb sucking. Then the thing that I mentioned was maxillary constriction. Now, if you see in the lower picture, you see the width of the palate in layman terms, if I would say, it's so wide. But when a child starts taking thumb, you see how constricted the palate becomes. Yeah, as you can see, the width in the upper picture, it's narrower, it's less as you compare to the wide palate in the lower picture. Now, why does this happen? So, see, in the normal scenario, what happens is, as you can see on the picture on your right, the tongue in its resting position is basically resting against your palate. Okay, and the muscle that you can see on the left hand side, the two muscles, that is your buccinator muscle and the orbicularis oris muscle. So, buccinator and orbicularis oris, both of these muscles, their forces are counteracted by the tongue, which is resting against the palate. because of which the palate is in the normal shape, everything is in equilibrium, there's no problem. But but as you can see here in this picture, when a child starts sucking thumb, what happens? Now the tongue is no longer in its position, in its normal position, which was against the palate, and we have the thumb. Because the thumb is now in the position of the tongue, and the tongue is now resting down, the tongue is no longer in that position wherein it was able to counteract the force of those two muscles, that means the buccinator muscle and the orbicularis oris muscle. Because of that, now these two muscles, they have no one to fight back their forces, they overpower, and the muscle lead to the constriction of the maxilla or the constriction of the palate, as I just shown in the previous slide. So there's an imbalance created because of which this happens. Now, another thing that needs to be understood is we see that not all the children who are having this habit of digit sucking end up having the same results, right? So the reason is that it depends, the bad effects or the adverse effects that is there on the oral structure, it depends upon certain factors. And the first of them can be the amount of force that is applied. Obviously, the amount of force varies from person to person, and the amount of force will determine that to what extent the changes are happening. The second thing is the duration for which that force was applied. Obviously, anyone who is taking it for a night long and anyone who is taking it intermittently will have different effects. And the third is the direction in which the force was applied. That means how the digit was placed inside the mouth. So that will also determine that what changes are happening in the child's mouth. And these factors are the reason why we see a variation of side effects or variation of responses amongst children having the same habit of thumb sucking. So that's it. So in this, I try to basically make you understand the reason behind encouraging your child to stop this habit of thumb sucking, because if you understand the reason behind it, you'll be able to motivate better your children to discontinue that habit. And I would try to cover it in my next video of how we can encourage the child and how we can stop this habit of thumb sucking. That's it for now. Take care. Thank you.